Good afternoon. My name is Daniel Valdez. I'm the Director of North Carolina and Mid-South Operations for the Hispanic Federation. What a great summit we've had so far. Thank you all for joining us. I'm excited to kick off this final discussion focused on the role of the Latino community-based organizations in COVID-19 recovery. I'm joined by nonprofit leaders and panelists, Oscar Chacon, who is the co-founder and executive director of Alianza Americas in Chicago, Monica Ramirez, founder and president of Justice for Migrant Women, and Angelica Salas, the executive director for the Coalition for Human Immigrant Rights, also known as CHIRLA. Welcome everyone. Before we kick off this conversation, we'd like to share some brief remarks offered by U.S. Representative, the Honorable Jesus Chuy Garcia. So we'll go ahead and hear from Representative Garcia. Thank you, Representative Garcia, for your message and for your continued advocacy for our communities, particularly our Latino immigrant communities across this country. And we'll definitely have an opportunity to talk about the way in which local organizations are going to be thinking about ways that we can reimagine not just our immigration system, but so many systems like our health system and our education system that have been as we've talked throughout the summit, that have been impacted by COVID-19 and particularly communities of color. So Well, I'm really excited to get us going. We only have a short period of time, lots of things to cover, so we're going to just dig right in. We're going to start by talking a little bit about how you all have seen both your organizations and other Latino-led and immigrant-led organizations really address the fallout of COVID-19. Can you shed some light into the ways in which Latino community-based organizations have had to fill in the gaps in order to address the economic and health inequities that COVID has exacerbated in our communities? And when you do that, when you answer that first question, if you can also just introduce yourself as well to our audience here today. And let's go ahead and let's get started with Angelica.
Good afternoon, everybody. It's first of all, I have to say thank you to the Hispanic Federation for being such a true partner during these such difficult times for our organization. I am Angelica Salas. I am the Executive Director of CHIRLA, the Coalition for Humane Immigrant Rights. And CHIRLA's mission is to create a just society fully inclusive of immigrants. And CHIRLA is a mass membership immigrant rights organization that does direct organizing of immigrant workers and immigrant youth. We do policy and advocacy at the local, state, and national level. We also do massive community education across the state of California. And then we also engage our community in civic engagement because it's important for their voice to be lifted up. But to your directly to your question, I think that immigrant rights organizations and Latino organizations in general have really had to step up and fill the gaps that the government is unwilling to fill. And so in this, what we saw right away was that as we were entering into a pandemic, our communities were consistently invisible to the planning of how to actually withstand this pandemic, invisible to their needs, invisible to their pain as well, because many of them were also losing jobs. But unlike the rest of America, many of our immigrant brothers and sisters, and I would say, here in California and in Los Angeles County, many of those impacted were immigrant women who lost their jobs. But unlike everybody else, they didn't have access to unemployment benefit because of their immigration status. So there was no safety net for them to fall on. There was really nothing but the support of organizations like ours and their potentially their church, their union, but really nowhere else were they actually able, in the initial run, able to access some of the vital services they were needing. And even as we were trying to respond and transform from this virtual reality into, to serving our community, knowing that most of our community really depends on the face-to-face, even as we were doing that and trying to provide those services to our community, we were busy advocating with the federal, with the state, and with the local government in order to ensure that our folks were actually included. And so through those efforts, we were able to push our state government, and certainly here in California, to provide disaster relief assistance to the undocumented. It didn't even come close to, obviously, what was being offered at the federal government, but $500 at a time, it made a difference for individuals to be able to stay in their home, purchase food, and pay utilities. And that continues to this moment. I really feel it's important for us to understand that during a pandemic, there is no discrimination based on the healthcare, on health. The pandemic is going to hit people irrespective of your race, your gender, your immigration status. Yet we were creating policies that were actually excluding individuals. So just for us, it was important that we as an organization offer the support that our families needed. And I also just want to end with saying that the other element that was really important was that most of the platforms that were being set up in order for individuals to access services were actually digital. They were through the internet. So many of the families we serve do not have access even to a computer, know how to use a computer. Their literacy offline is still, maybe a sixth grade education at most. Getting them online and to try to access the services was very difficult. And so therefore, That's why we continue to be right there with our families in order for them to be seen during this pandemic, especially since they have suffered so much. So we want their pain and suffering to be seen, but also their needs to be seen during this time.
Thank you so much, Angelica. And I think you brought up some great points, and a lot of the things that we're hearing from members that the Hispanic Federation works, over 300 members across and partners across the country, right? And a lot of the same issues that you're bringing up, we're hearing throughout, and we've of course documented in that report that we released today. Monica, can you share a little bit?
Yes, thank you so much. And it's a real honor to be here with all of you. I'm grateful for all the work that you are all doing around the country. I mean, it's taken all of us to get to where we are now, and we certainly have a long way to go. I am the president and founder of an organization called Justice for Migrant Women. I want to start out by wishing you all a happy National Farmworker Awareness Week, which we kick off today. My organization focuses on the rights of migrant women workers, including farm workers. I come from a migrant farm worker family, and I'm based in Ohio, and our organization works across the country, serving the needs of farm worker women as well as other migrant women who move for the purposes of work. And we now know that that isn't only in agriculture, that's for many other jobs. And I think that coming from a farm worker family, myself and other team members, we felt an immediate sense of fear when the pandemic started to reveal itself, because we knew instinctively that our community would be left behind, and that if we didn't step in, that there was going to be immeasurable trauma, and that we were going to lose a lot of people in our community. And unfortunately, that has been the case. But I think that perhaps one of the most important things that we've been able to do over the course of the past year, and certainly at the start of the pandemic, was that we started to reach out to our community to just say, are you okay? And what do you need? And what's important to you? And do you even know what's going on? And what we heard from farm workers around the country was that they didn't know what was going on, that they were called essential, they were given a little card, and they were told that they could keep going to work, but they didn't know much more. And their lives were basically turned upside down overnight, like the rest of us, except they had to continue to work and face real risks and balance trying to figure out how to educate their children, making tough decisions about whether or not to take their children with them to work in the fields and expose them to those dangers, or leave them at home by themselves. The farm worker community and other migrant women were faced with constant, difficult choices throughout this pandemic, and those are choices that they've been, had to make throughout their lives, because we know that there's always so much instability for our communities, and this pandemic only further highlighted the ways in which the systems were not built for us and certainly weren't serving us. So in addition to just having those check-ins, and we started having a series of town halls with community members, which became really important because it allowed our work to evolve over the course of this pandemic. We moved to create a pandemic relief fund. As Angelica was saying, just having those resources available to buy food. I mean, I think one of the most heartbreaking things that we learned really early on in the pandemic was that while farm workers were continuing to work hours each day to feed us, they were going home and they didn't have food. And so our fund was created in order to provide farm workers with food and with other basic necessities. We also created a masks project because farm workers were talking to us about the difficulty they had in just accessing masks, and in places where masks were being required, where they couldn't even go into a grocery store or some other location without a mask. They just didn't have them. And they were, going to work, and they were still having to breathe in the pesticides and all the terrible things that farm workers breathe in every day. But on top of that, with the risk of the pandemic and the virus. And so we created the Farm Worker Mask Project. And our humanitarian work has just had to move as the community has called on us to move. And thankfully, we've been able to work closely with organizations like yours. And I know on the ground in Puerto Rico with Hispanic Fed, because we've been able to serve the needs of farm workers in 35 states and in Puerto Rico through our network of allied organizations. And one of the things that we've learned through this process is that in addition to just basic needs that aren't being met, there's so much mental health stress on our community. So one of the latest projects that we've been developing is focused on the mental health and well-being of the farm worker community and trying to help folks manage this crisis to the best of their ability. Like Angelica was saying, we've also been engaged in conversations with political leaders about not only how they've left farm workers and other immigrant workers out during this pandemic and have called them essential, but continue to deny them essential rights and benefits. But we've really stressed the fact that farm workers, domestic workers, and other workers have always been denied rights. And we can't pretend like this situation just caused these problems. The reason that our communities have been so vulnerable is because our communities have been marginalized and targeted for a long time. So those conversations are continuing, and we just really are grateful for the allied organizations that we're working alongside, because together that's how we've been able to surface some of the most pressing concerns of our community.
Thank you, Monica, for sharing. And happy Farm Worker Awareness Week. I know that here in North Carolina, one of our partners, Student Action with Farm Workers, has been reaching out about making sure that that's happening here in North Carolina, and I'm sure all over the country. So thanks for your work on that. Oscar, you want to close us out on this question?
Absolutely. But first of all, let me tell you that it is an honor for me to be here. I'm grateful for the invitation to be part of this panel. We have been for many years a close partner to Hispanic Federation, and it is a partnership that I only hope that will grow even stronger as we go by. Alianza Americas is an umbrella of national nature, which basically brings together Latin American immigrant-led organizations throughout the country, 55-member large nowadays. And I want to echo very strongly everything that was already said by both Monica and Angelica. I won't repeat. I will point out, though, that the role of community-based organizations within the Latino community, and more specifically within Latin American immigrant communities, is absolutely crucial. I mean, we are in many ways the equivalent, of Black churches for the Black community in the U.S. And it is important for us to make that be known as much as we can, because one of the things that we need to realize is that community-based organizations at the beginning of this COVID crisis were not in any way, shape, or form adequately prepared, to deal with the realities that we've been facing over the past year. And that is because of a lot of the things that were already said by Monica and Angelica. Let me remind everybody that Latin American immigrant-led organizations and Latino-led organizations in general have been neglected for decades when it comes to philanthropy in the U.S., when it comes to government contracts money. And we have a major deficit that was already real before COVID hit. And so we had to come from way far behind to be able to adapt very quickly and deal, with the fact that we were indeed beginning from a very far away from ideal conditioning as far as coping with what COVID was bringing, which is frankly nothing short from a major assault on the life of many Latinos in the U.S., which is why we are among the top people affected by both infections, but also death. And I think it is important to highlight that very much, because going forward, we cannot go back to where we were prior to COVID. We need to absolutely become good practitioners of the notion that we must build back better together. And I think that implies also shifting dramatically the way we go forward about how we support Latino-led, Latin American immigrant-led organizations across the nation. Let me, number two, point out very strongly, and I'm echoing to a degree here something that was already said, but the fact that people without documents in the U.S., immigrants without visas in the U.S., have been systematically excluded. And I am happy for the changes that were made, even with the last relief package passed last year, but even more so with the one just recently passed. But let's face it, there is still a serious attempt to undermine Latino health in the country when people without documents are excluded. Let's remember that nearly 80% of the undocumented population in the U.S. are Latinas and Latinos, Latinx. So when immigrants without papers are excluded, what they're really saying by and large is that Latinos are excluded. And I think it's very important to own that, to fight about that, and make sure that we don't go forward keeping these exclusions in place, which frankly are not just harmful to our communities. They're harmful for society, because every single specialist can tell you that when you leave intentionally a block of people out, then we are all going to suffer the consequences of that. So we are not really arguing just about us, but arguing about a better society, a better country. And the last point I want to make is that because of the reality of exclusion, of oppression that we were facing prior to COVID, which made so many people in our community not trust, government at all, we are also facing a very serious challenge trying to persuade our communities to be able to indeed get in line for the vaccine. In theory, everybody should be able to qualify for the vaccine. But when you combine long existing systems of exclusion with the totally understandable doubts that many people in our community have, we are in for a serious challenge, making sure that our communities get indeed included. And the very last thing I will say is, you all have already mentioned it. Another panels also mentioned this. It is not just that we don't have access to internet. It is not that we don't have access to smartphones. The problem is having either one of those does not resolve the serious implications of the digital divide that has affected our communities and that has made many of our own organizations having to completely change and become tech savvy to be able to teach not only how to use Zoom, but how to properly use smartphone with so many people in our communities. That was one of the main things that we were able to do, in part with Hispanic Federation support, to invest in providing leaders in community-based organizations with basic tools for them to be able to know how to navigate this moment, but also how to then translate this knowledge and skills to the communities that they are serving. And so I think that we have our work cut out, and I only look forward to more partnerships across the board that can ensure that Latino communities, once and for all, become truly part of the American family.
Gracias, Oscar. And I think that you brought up some amazing points, and I think a lot of the folks here who are watching this panel are echoing a lot of these sentiments as well, by just the reactions that we're seeing. And I think that something that you mentioned about how do we make sure that we re-envision, right, how we build back better as a community. So that takes me into my second question, which is around, this American Rescue Plan that we've been talking about during the summit, and that has been a huge piece of legislation. There's a lot of executive directors here, a lot of folks that work with Latino community-based organizations that are hearing us today. How are CBOs going to be able to benefit from this American Rescue Plan, and what should they be aware of to make sure that they're able to take advantage of those aspects of the bill that could potentially really help them continue to further their mission of serving and really helping their local communities? And we'll start off with Monica this time.
Great. Well, I think that, it's really important for all of us to know that in this bill, there are a lot of different monies that will be available to help with a lot of important services. First, I think that to the extent that we all care a lot about culturally appropriate and linguistically appropriate tools, information, particularly given the gap in information that actually can reach our community, money that's been put into the bill for the CDC for outreach is going to be really important for us to figure out how to access. I've been saying all along that it is one thing to say that information is available, and it's another thing to actually make sure that it reaches our community. And so those dollars going to organizations like ours that are trusted by our community and can make sure that the right information gets to our community will be critical. I just want to put a fine point on something that Oscar said that I think is super important. As I've heard people talk about the hesitancy of community members to get tested or to get vaccinated, sometimes I hear this tone of judgment, like it's absurd that people wouldn't want to get tested or wouldn't want to get vaccinated. And, as Oscar pointed out, why would they, with all of the things that they are already afraid of and all the systems that have already harmed them? There's so much concern about what it will mean to come forward to get help, particularly after an administration spent so much time trying to do everything that was in its power to make our community become public charges so they couldn't later get benefits, if there were to be an immigration bill. So it isn't absurd. And it's really, really important that we be able to do the work with the right resources to be able to get information to people about how to get tested and how to get the vaccine. In the farm worker community, one of the big things that happened was that as the cases of COVID were increasing, the resources for community health centers was falling and community health centers began closing. So this bill will provide more resources for health clinics to do vaccine education, to help administer the vaccine and also testing. And there will be a great number of resources that will reach rural community members, which there's usually a pretty big gap when it comes to rural healthcare generally, but at least there will be some resources there for the rural community. And I think that one of the other important pieces that I want to highlight for those who are following along who maybe also serve the farm worker community is that the migrant Head Starts were one of the hard hit programs during this crisis. And many of our families look to Migrant Head Start for information and for food and for other basic items for their families. And thankfully in this bill, there will be, I forget the number off the top of my head. It's quite substantial. It's $1 billion actually that will be moved towards Head Start programs, and that will include migrant Head Start programs. And so for folks who are working with Head Start aged children, you should know about those resources too, because that will be an important point of contact for our communities.
Thank you so much, Monica. And I think you bring up a number of ways in which local organizations can really think about how they're going to engage with this new bill, and the Hispanic Federation will continue to share resources and information out. Oscar, let's go with you, and then we'll finish up with Angelica.
I believe that it's important to plan ahead, but more important than anything else from our point of view is to make sure that communities know what is in this particular new law, because there is so much need for literacy. We are actually having this very afternoon the very first of several workshops geared towards community leaders so that people can really understand, what's in it, because it's such an expansive law. I mean, very expensive, let's face it. $1.9 trillion is a lot of money. And what we need to make sure is that we get the fair share that our communities deserve. And that means, for many government agencies to really challenge themselves to truly be inclusive of Latino communities in the proportion, that we need to be included. When contracts are being awarded, it's going to be crucial that they looked up who's actually getting these resources. Because if we really want to go seriously about building back better together, that is what it takes. Changing who gets the resources, who actually know Latino communities can be in a better position to do it. And I believe we are, already going in a good way about it. I am proud to let you know that we recently received a CDC grant that will allow us, among other things, to produce content about vaccine and its importance in multiple indigenous languages, in Garifuna, and of course in Spanish. Because a lot of people talk about Latinos as if we are all exactly the same and we only talk Spanish. We don't. We are extremely diverse, and it is important that we understand that complexity, that diversity really means, and make use of every possible opportunity, every possible asset that this particular law can actually bring into our community so that we can make a difference for Latinos. And of course, there is so much more to be done. The last thing I will say is I am a little bit concerned that a lot of people may believe that just spending a lot of money somehow will land us to a new reality economically, socially, politically, culturally. and it doesn't. I think it is important to understand that alongside with a lot of money, we really need to do a better job imagining the kind of inclusive, equal, sustainable society that we really want to contribute to build for the future of our communities and the future of the Americas, because we are incredibly linked with the realities of life in Mexico, Central American countries. And if we keep ignoring that, we are simply shooting ourselves in the foot.
Thank you, Oscar, for that. And I think that for those folks who are interested in learning more about the workshops that they're having, please make sure that you follow Alianza Americas. So Angelica, you wanna close us out on this question, and then we'll have one more question before we end this panel.
Sure. Well, what I want to make sure everybody who is here does is